my gosh, guys, I went to the doctor this morning.
And how was that?
It was really good. It was really good. She got all the tests done.
Oh,
everything I've ever wanted was done. Yeah.
Oh my god.
We got an EKG.
Wow.
She did a PAP.
Oh wow.
Yeah, she sent me in for a stress test, like the whole thing.
I was in at my doctor's office the other day and I went in with a toothache and they did an EKG. It was wonderful.
Amazing. So thorough. Don't you love a doctor that does whatever you ask?
Yeah.
Hey, St.Margaret, have you heard all this talk about unnecessary tests at PCP offices? They're like ordering EKGs, pap smears, stress tests, even referrals when the patients are asymptomatic.
How do you think they get 5 stars on doximity?
Hey, we should investigate.
I don't like to get in between physicians and their patients.
What? You do. That is literally all you do.
I don't influence practice change. The evidence does. But without evidence, it just seems like meddling.
But it's going to lead to more downstream effects. More specialist visits, more testing, more cost.
I'd drop it if I were you, Bloomfield. I gotta figure out why the police chief's been stonewalling me a lot lately. Oh, you got something on your ear there.
Oh, really?
Yep.
Oh, thanks.
Dr. Chris will be in a minute.
Yeah, so when I do my jumping jacks, my heart goes really, really fast. Like my watch says 110, sometimes even 112.
We can get the EKG.
Actually, no, I'm okay. Maybe next time. Bye!
So what'd you find out?
Ah.
You passed the test. Any question requires further investigation. I'm pleased.
But how did you even find me?
I was tracking your location.
Oh.
I have a theory, but first we need to ponder a bit. I was at the club last night and heard about an article that may help us out.
Wait, you go clubbing?
Yeah, journal clubbing.
Okay. Yeah, that makes more sense. But how could you even study that? If you did a prospective control group, that would take forever. And how would you randomize? How would you mask?
You'd need a retrospective cohort. It's the only way.
How would you even have a control group? They would have to have the exact same baseline characteristics.
It's possible using propensity score matching, but no time to unpack it right now.
Subsequent specialist visits, diagnostic tests, and procedures were the main outcomes. That seems like poem level stuff to me. I wouldn't want additional costs or appointments if I didn't need them.
Exactly. Do you remember a name of one of those other physicians you overheard?
Yeah.
You're going in.
Yes!
Hey, Bloomfield, check this out.
Oh, yeah. Nice. All right, put it down. The doctor's going to be here any minute. Come in.
Hi there, I'm Dr. Cross.
Do we know him?
Huh?
No, I've just got one of those faces. Are you Mrs. Goose?
Oh, please. My mother is Mrs. Gears. Just call me silly.
So you're here for your annual physical. Any particular concerns today?
Yeah, actually, so my Mother Goose, was just diagnosed with an arrhythmia. And I'm worried. I think I should get tested.
I don't know if we need... We can get the EKG today. Anything else?
There's one more thing. I'm getting ready to do a paper football tournament, and I am going to do some intense workouts. So just want to make sure my lungs are okay.
We better get a chest x-ray.
I don't know. What do you think?
I think I need some more light before I can make a decision.
Pay no attention to that man behind the curtain. What's going on here?
I'll be the one to ask the questions. What's going on here?
Just order the EKG. What's wrong with being thorough? Think of your patient satisfaction scores. And what about the threat of lawsuits?
Looks like it's gonna be curtains for you. But how did you know to look behind the curtain?
It seems like nowadays physicians have less and less control over how they care for patients. Insurance companies, EMR pop-up fatigue, focusing too much on surrogates, something had to be up.
Makes sense. That's why the providers kept looking behind the curtain.
Oh, wow.
Good. The police chief's back from his vacation.
He seems so cheerful and more well dressed.
Good. Evidence will prevail. Ep.5, case log entry 5. Well-meaning providers deceived and led to the dark side. Behind the curtain, behind meaningless work, there is always someone. Although, did not expect a green-suited, mustache-eyebrowed man this time. Bottom line, testing in low-risk patients as part of an annual health exam increases the likelihood of subsequent specialist visits, diagnostic tests, and procedures.
Yo, St.Margaret, what's up? You mentioned the authors used propensity score matching for this article. Do we have time to unpack it now?
When will I have time for myself around here?
I don't know. You said it was a way to conduct a retrospective cohort study. What did you mean?
Well, first, in a retrospective cohort study, the outcome has already occurred or not occurred. The researchers identify patients or a cohort to see if they have that specific outcome.
Right, but where does propensity scoring come in?
Propensity scoring is a way to strengthen a retrospective cohort analysis. Think of it as a retrospective study on steroids. It is a way for the researchers to conduct pseudo-randomization.
Wow, that makes sense. Since the patients and outcomes are in the past, there is now a way to match up patients in a randomized way.
Right. In a prospective RCT, researchers set a strict set of inclusion-exclusion criteria. This then dictates the types of patients included, and the other patient demographics even themselves out with a large enough sample size.
Okay, exactly.
But in a retrospective cohort, there is no way to have a list of inclusion-exclusion criteria. Instead, researchers can use propensity matching to help even out group characteristics.
All right, this is my favorite part coming up.
What?
The one where you do the animation thing with examples.
But I wasn't gonna...
What's it gonna be this time? Animals, states, constellations?
Fine. Let's look at this series of shapes.
Oh, okay, two shapes.
Researchers in propensity scoring trial can choose whatever characteristics or covariates they want to match patients. Looking at this cohort, you will notice different covariates, including shape, color, and size.
I see. And these can represent like age or gender or socioeconomic status in an actual trial, right?
Precisely. Let's say the researchers wanted to match a cohort and were only concerned with color and size. They will match pairs as closely as possible. Some will be near identical except for what study arm they are in.
Like whether or not people were screened using low value tests in the trial we reviewed.
Correct. And in this example, since the shape doesn't matter, we are able to match a few more participants to expand the size of the cohort.
Awesome. Let me see if I could apply it to the tables in the article.
Finally, a chance to kick my feet up.
Don't get too excited. Looking at table 1 and using chest x-rays as an example, let's see. There are way more people unscreened than screened initially. And the groups are not matched very well.
Yep, like percent of women. Women made up 38.5% in the screened group and 62.4% in the unscreened group.
But after they use propensity score matching, they have the same N and are much more similar than before.
Right. The percentage of female patients is now identical.
Wow. So this led them to make a stronger conclusion that low value tests don't provide any poem data and lead to just more fuss for patients.
Correct. Many covariates can be chosen to match. In this study, there were upwards of 15.
Wow, that's a lot.
Yeah.
What's this? Oh, yeah, it's your scrapbook. Wow, that looks awesome. Nice work.
Thanks.